The patient has been treated with second-line therapy consisting of 5-FU and Aliary, and now we need to think about what other treatments are available. And I think we should have gone back in the very beginning. We always have to think about experimental trials, clinical trials, which are really going to pave the opportunity to advance the field and hopefully will continue to improve survival outcomes while maintaining patients' quality of life. So in this setting, it's always reasonable to consider a experimental clinical trial. Certainly, that's a consideration in the front line and second line setting. For this patient, you would consider that. Alternatively, the patient has not been treated with a platin. So in this situation, you might introduce oxaliplatin either as FOLFOX. You could also use cisplatin. There's some very interesting data combining Abraxane, gemcitabine, cisplatin as a 3-drug regimen, which with very interesting results. Other opportunities include maybe capecitabine, oral 5-FU, although there's limited data with that agent. And all along, we really need to continue to focus on supportive care. Palliative medicine may become more important in this setting. So managing the patient's symptoms, again, trying to be in the positive in terms of the psychologic status of the patient, but we do have some other treatment available options. Another consideration is what we said earlier. Is this a BRCA patient? Well, certainly if that's true, you're going to try to get a PARP inhibitor. Is this a patient that has a MSI high or defective mismatch repair status? Will they benefit from checkpoint inhibitors? The other thing that I'm a proponent of is rebiopsy clinics, meaning does the cancer change during our treatments? Is there more expression of a targetable mutation as the patient has gone through the spectrum of therapies that we can take advantage of? So getting molecular analysis, getting tissue may be important. I know the insurance companies don't like that, but getting more tissue to see whether the cancer has changed may be important in terms of deciding additional treatments. But by the book, I think a platinum is the most appropriate available therapy for this individual.